So talking about maternal anemia, maternal anemia is like a complication of pregnancy, or it could be that the woman actually had the issues before pregnancy. So maternal anemia is quite simple, right? You just have to do it. A pregnant woman is having what? A shortage of red blood cells. So just like I told you guys, it could be before pregnancy, like she had this issue before being pregnant, but pregnancy kind of like triggered it, because in pregnancy there's high demand for a lot of things: iron, folic acid, minerals, all those vitamins. Do you understand? So it could cause some shortage most of the times when the woman is not taking enough to replace. You understand? So maternal anemia just have to do it, right? This is anemia. The red blood cell count is dropping, all right? While your normal blood film, red blood cell count is normal, just literal like that. So maternal anemia, especially during pregnancy, is a potential serious condition. It often affects what? Both the mother and also the baby that is developing. Alright, so what is maternal anemia? It usually occurs when a woman has too little red blood cells that are healthy to be able to carry oxygen. Okay, so during pregnancy, blood volume increases by about 20 to 30%, so which raises the demand for iron and other nutrients. You understand? So pregnancy could actually complicate things most of the times if the woman is not having a replacement of those things and all of that. So the most common types of anemias that could come up and they are related to pregnancy is iron deficiency. So the body's demands for iron is getting too high, the mother can actually keep up with it. Folate-deficiency, the request for folic acid is getting too high, the mother can't keep up with it. Vitamin B12 deficiency, vitamin B12 request is getting too high, so maybe the mother is not taking enough to replace. You understand? So all of these minerals that are listed here are needed for your red blood cells to stay healthy. So if they are lacking, the red blood cells are more vulnerable to be destroyed by the reticular endothelial system that breaks up red blood cells that are not healthy. Do you understand? So that just works. So risk factors is, if a woman has what? Pregnancy that is twins, triplets, the demand for the body is kind of like doubled. In one pregnancy is doubled, right? Twins will be tripled. Do you understand? So the demand is more in multiple pregnancies. Right, have closest place pregnancies, so the woman is not allowing her body to rest. As she gives birth, the baby is not even up to 1 year, she hammer again. Do you understand? She has been experiencing heavy menstrual bleeding before pregnancy, so she has been losing a lot of blood way before going into the pregnancy even. So she has been vomiting frequently due to morning sickness, have poor dietary intake of iron, folate or vitamin B12. This one just have to do it. You are not actually taking foods that contain these things adequately. So effect of these issues on babies is low birth weight babies, preterm delivery, neural tube defects, fetal anemia. Prevention and management is take foods that contain a lot of iron, take foods that contain a lot of vitamins. Then they should regularly screen you, so that they can be advising you, It's not a strict thing, you can just be switching over and all. Supplementation, so oral iron, or in severe cases intravenous iron therapies. You can actually be doing all of that maternal anemia stuff. Okay, so that's it for maternal anemia.